So welcome to BW Healthcare World, Dr. Tyagi. Thank you so much for taking our time to be with us today. But before we get into the treatment options of, that we have for prostate cancer, how big do you think is the problem of prostate cancer in our country? And why is it growing so fast in India?
So first of all, thanks, Mr. Narula, to give me an opportunity to share my thoughts about the cancer prostate. Yes, if I say in last 20 years after 2000, the incidence of cancer prostate has risen. And I believe that there are two reasons for that. The persons are becoming much more conscious about their health. So if somebody has a problem in their family, or if they come to know about somebody having a cancer prostate in the society, they try to find out is I'm having a cancer, and the screening tests are readily available, which were not so readily available in 90s or 80s. And secondly, yes, whatever the lifestyle which we are having because of the smoking, even the pollution which we have in NCR, and all those things also increase the incidences of the cancer. So I believe that there are two reasons for that. The screening has increased. Persons have become much more conscious about their health. And secondly, all the environmental factors which predispose us to the risk of having a cancer. And in this one, I think I should add one thing more. So in 90s or before 2000, there is more patients who are coming with advanced cancer prostate. Now the patients are much more coming with localized cancer prostate, with a cancer prostate which is at the earliest of the stage. So that's also support the statement the patients are becoming aware about their disease and getting the screening done.
And, when we talk about prostate cancer, we've always had treatment available for the last few decades. But how has the treatment evolved over the last few years to where we are today using the best of technology?
I think the treatment for the prostate cancer has evolved good time. To all my patients, I shared a normal story. I started my medical journey in 1996. And during my MBBS time, if there is a disease called cancer prostate, the only treatment available is give a hormonal therapy. That's all. Nothing can be done. And when I doing my post-graduation in Indore, whenever a cancer prostate comes, everybody is reluctant to do a surgery because the surgery at that time is an open surgery. It has its own demerits. And sometimes rather than giving a successful outcome to the patient, we are giving certain side effects which become a burden to his life. So at that time, during my 3 year of post-graduation, I have seen only 2 surgeries for cancer prostate. So that is the incidence which is. When I joined my super specialization in urology, we do have cancer prostate surgeries, but those surgeries are, you can say, once in a quarter or 3 or 4 in a year. And again, because at that time, the surgery become from open to laparoscopy. So in my MBBS time, no surgery. In my MS time, open surgery. During my DNB time, it may be a laparoscopic surgery. But when I saw that surgery, it seemed to be a very crude surgery. Something the assistant is not able to understand what is going on, right? When I finished my MCH and DNB, then the robot came into the picture, and the whole scenario changes. So whatever the disadvantage of an open surgery, that is because prostate is an organ which is lying deep into the pelvis cavity. You cannot see it when you are removing it. So now you can see it. In a laparoscopic instrumentation, it's very difficult to do the surgery in the pelvis. Now with the robotic instrumentation, you can just replicate whatever head movements you are doing. So after my super specialization in urology, the incidence of the cancer prostate surgery in my hospital has increased. Now, myself is doing about 1 surgeries in 10 days or a week. So that's how the surgery and the disease spectrum have evolved from in 1996, no option of the surgeries, to the early 2000s, open prostatectomy, then the 2010 or 11 or 6 or 7, the laparoscopic, and after 2012 and 13, it is the radical prostatectomy done by robotic surgery.
That's a very fast-paced evolution, because in 20 years or less than 20 years, we've seen from going no surgery to doing the most modern form of surgery today. Dr. Vipin Tyagi, what is robotic prostatectomy and how does it work?
So I tell you, when somebody asks me what is robot, are you just programming something and it is more like you just programmed and you just have a cup of coffee and the robot is doing the surgery? No, it's not like that. So if you go by the Oxford Dictionary, the robot means forced labor. You are getting the labor to work for you. Now, in a robot, what we are doing is a master-slave system in which there is a technology, a software, which convert every movement which I'm making by my hand at the tip of the instrument in the real time. So what is it's providing me? So if we take the example of a prostate, now prostate is lying deep into the pelvis. We are not able to see it. Even when we are seeing by the laparoscopic way, it is a two-dimensional vision, right? When we are reaching with our hands or a laparoscopic instrument, which are rigid instruments, we are not able to manipulate it in a way which we want to manipulate. Now, what the robot given us, it given us a 3D vision of something which is lying deep inside. It is more like a tunnel in which something is lying. So you can see how long is the tunnel, how far is the gland from the wall of the tunnel. So you better understand the disease. Secondly, now what robot does, whatever movement my hand is making, all these movement can be replicated at the tip of the instrument, which have the same capacity of my hand. So now I have overcome two limitations of open surgery that I'm not giving any incision, of laparoscopic surgery that my instrument are not rigid. So it has overcome both the disadvantage of the open and the laparoscopic surgery. Now I can put my hand inside the body cavity actually by using a robot. So it translates every movement of mine inside the body cavity in a real time without even a millisecond lag. Right? If I tell you the story how the robot developed, so NASA started this project in 1970s to decrease the mortalities in the warland because US have armies which are going beyond the boundaries of the US. And what they have found that they are not able to replicate the movement of the surgeons performing in US outside US. So they end up into doing that they can translate the movement by a wire, not by a satellite things. And then the intuitive company taken this whole objective forward. And in nearly 2000, this robot came into the picture. And you will be surprised that the most common surgery performed by a robot worldwide is prostate surgery. Because that is the only part of the body which is inaccessible, which is not under your direct vision, which require all the movements like you have to grab the prostate like this, you have to grab the prostate like this. So the robotic radical prostatectomy is the key surgery because of which robot came into existence. And it is right now where it is right now.
And Dr. Tyagi, what are the benefits? I know you've shared the some insights into why robotic surgery is better than laparoscopy or the other forms that had already existed. But what are the benefits that the patient feels about choosing robotic surgery for localized prostate cancer over traditional forms of surgery? And also, what is the additional cost that is there if you were to choose a robotic surgery, and why should people, despite the cost, choose this?
So the advantage of the robot surgery are, I always say there are threefold advantage of robotic surgery. One to the patient, that patient is not getting a cut. So any surgery can be done by a minimal invasive method, or you can say keyhole surgeries, right? So that give a better recovery of the patient. Now, say for example, for the cancer prostate, at my time when the open surgery is being done, the patient need to be admitted for 7 to 10 days. Now my patient come in the morning of the surgery and can be discharged the next day or after 2 days. So that's how the recovery of the patient. The second fold, when you are seeing good, when you are operating very precise, the blood loss is negligible. So now for last hundreds of surgeries, I never arrange a blood during my radical prostatectomy. So you are cut shorting the element of the blood, which is already shortage in a country like India. Because the patient is admitted for a lesser time, the recovery of the patient is much more better. So you know that being a professional person, that we are human resources. The less time I spend in a hospital or lying in a bed, more useful I can be to the society and to myself. So that ultimately translate into the human resources, which is a financial source for everybody. So that give a patient a benefit. Now, regarding the disease benefit. So when we talk about the disease benefit, say for example, again, for the cancer prostate, something which was not done 25 years back, now it become a routine. So 20 years back, the indication of prostatectomy is very, very less. Now the indication of the prostate surgery and the benefit of the prostate surgery are very large. If we take the example of kidney tumors, now the kidney tumors again are on a very high rise. So now we have a method called partial nephrectomy in which we just take out the tumor and prevent the whole kidney. So initially, before the robotic era, only about 20% of surgeries are done like this. So, but with the advent of the robotic, the near about 70% of the surgeries are partial nephrectomies. And if I give you data of about radical prostatectomy surgeries, the radical prostatectomy in 2000 is about 13.6%. Now it has increased to more than 75% of the all prostatectomies. So this is how the advantage. So this is for the disease advantage. Now for the surgeon advantages, I also want to be comfortable. Being in India, we are doing 3, 4, 5 surgeries in a day, right? I want to do a surgery in a more comfortable environment, in a more safer environment. And lastly, because if I have a good tool in my hand, I can be more precise. Like we do doing this Zoom meeting because it gives us a good quality of audio, video, and everything. So why to waste the money to just drive my car to your place and you drive your car to your place and waste all type of resources? So to the patient, for the indication of the surgery, and for the surgeon, the robotic has changed the scenario to all three of us. But mind you, not for all the diseases, not for all the surgeries. You have to be rationalized when to use a robot. It should be optimizedly used. So because of these all three reasons, I always say that you are not actually investing a high cost. You are actually decreasing the cost, because in the long run, it becomes more cost effective. So if you see cost benefit, it can be on a financial things, can look more costlier than an open surgery. But if you say cost effective, the robotic surgery in majority of the cases, it is cost effective.
And how expensive is it to go in for a robotic surgery compared to a traditional form of surgery or a minimalistic surgery? And how do you say it is cost effective?
So the cost wise, any surgeries which are done in robot become say about a lakh or a 1.5 lakh Indian currency rupees higher than the laparoscopic rivals. And when I say cost effective, it means all the examples which I have given, that the patient recovery is fast, you're not getting any blood transfusions done, the hospital stay is less, so you can use the hospital bed for more number of patients. The patient who need to be on a rest for a month now can start its own duties after 15 days or 20 days, become much more good for himself. So that is cost effective. You cannot just say, okay, the laparoscopic surgery is like in radical prostate, laparoscopic surgery costs about 3.5 lakh rupees. The radical prostate by a robot can cost about 4.5 to 5 lakh rupees. And for a matter of record, nobody is now doing a laparoscopic surgery. Laparoscopic surgery is now become a compulsion for the doctors who do not have a robotic facility.
Okay. That's very important, because the indirect costs are much higher if you were to go in for a traditional form of surgery.
Yes.
That's important to understand. And you also mentioned that, robotic surgery or a prostate cancer surgery is not for every case. So what are the types and stages of prostate cancer, and which one of these can be treated through using a robotic surgery?
So I do a lot of urology cancer. So somebody, if you come to me, that whenever we say that you have a cancer, the next question automatically came to everybody's mind, which stage of the cancer it is. So I always say that there are 4 stages of a cancer. Stage 1, if it is confined to the organ from which it is originating. So in a cancer prostate, if it is just confined to the prostate, I say it is a stage 1 disease. Stage 2, if it has gone beyond the area of the prostate. Stage 3, if it goes to the lymph nodes, the regional spread. And the stage 4, if it is around the body. So for practical purposes, any cancer which is a stage 1 or a stage 2 can be treated by a local treatment. And when we say local treatment, it is surgery most of the time. And if the surgery is not possible, you can go for radiation and all those things. So that's the same true for the cancer prostate. If a cancer is a stage 1 that is localized to the prostate or just gone beyond the prostate, that is stage 2, we can offer radical prostatectomy by a robotic method to these group of patients. Experimentally or investigationally, now being radical prostatectomy is now being done even for stage 3 and stage 4 cases in selected cases. Because the idea is those are the if there is a cancer prostate, so that is the main you can say the source of the cancer. So it is the main camp of the cancer. So if you remove it, it will increase the survival advantage in a stage 3 and a stage 4 disease also. But if we go by the guidelines right now, stage 1 and the stage 2 disease should and can be done by a robotic way.
And Dr. Tyagi, what kind of preparation do people need to do for a robotic surgery for prostate cancer? What is it that they will need to do before they come for a surgery and before the surgery starts?
Nothing. They just have to rely on the surgeon and the technology and just keep with a smiling face, with a positive frame of mind that I am here to get treated and to get cured, and this can be done. So there is no special preparation. When I counsel the patient, most of the time it is my preparation actually to counsel the patient to get a surgery done, and secondly to get a surgery done by a robotic way. So sometimes the patient come to me and say, okay, doctor, robot is too costly. I cannot afford them. So it is a counseling which we do to them to make them understand that, okay, you are paying this much of amount extra, but what you are gaining, this is the thing you are gaining. And this question most of the times, what precautions I need to take before the surgeries and after the surgeries, nothing. The only thing which, sorry, I'm interrupting you. The only thing which I need to emphasize here is there should be in a cancer prostate patient, there should be a gap between the biopsy of the prostate and the surgery. That should be at least 3 to 4 weeks. So sometimes what happens, the patient get a biopsy report done, say on 10th of the month, and he came to me on 12th with the report and says, now I have a cancer, operate me immediately. So the only preparation which I tell them is wait, because that 2-3 weeks give a better result of the surgery rather than operating right now. That's the only thing which we need to do.
And why this 2 or 3 weeks, sir? What happens in these 2 or 3 weeks?
So when we do a biopsy, we are giving multiple holes in the prostate. So there will be some bit of inflammation and fibrosis. So if the fibrosis is happening at that time when I'm operating, that will not give a better result to me and to the person. So when we wait for 3 to 4 weeks, all those fibrosis is gone, because most of the time the biopsy is done through the transperineum or through the rectum.
Mm-hmm.
So it's more like if you go to and give a blood sample, that hole takes time to heal. It's not after an hour it's healed. So if you have 14 type of those holes in your prostate, it will take time to heal.
Got it.
And prostate and prostate cancer surgeries, they are not just oriented towards taking out the cancer, which is a primary objective. Secondary objective is to prevent your erections, to prevent your urine leak. Those will become much more better if we waited for this 3 to 4 weeks.
Okay. And you mentioned that, the time for the whole process is that you come one day and you're probably, if all goes well, you're out the next evening, right, from the hospital. But how long does the surgery itself take?
So surgery from when we start the surgery after giving the anesthesia until the end when we take out the specimen, take roughly about 2 hours to 3 hours. That depends upon how big is the prostate, what steps we are doing, how complex is the procedure, because every human being is different. So you cannot just take it as a 2 hour surgery. So it's from 2 to 3 hour surgery time. And whenever when some attendant asks me how much time it takes, so time varies. So for a attendant, the time started when the patient goes wheeled into the OT. But after wheeling into the OT, it is anesthesia time, the preparation time, and then the surgery being done. And for him, the surgery ends when he come back to the room. After the surgery, the patient will stay in the recovery room for 2-3 hours. So for the patient attendant, it is a 4 or 5 hour job, but actual surgery is about 2 to 3 hours, depending upon the case.
And Dr. Tyagi, what are the side effects of a prostate cancer surgery?
So, side effect actually, whenever we take out any organ, so all the functions that organ is doing for us, those will be compromised. So, prostate has twofold of functions, actually threefold of functions. A, it provides the main substrate of your semen. The sperm is produced in testis. The main substrate is provided by the prostate. And most of the patients who are coming with the cancer prostate are more than 50s and 60s, so they're not very much worried about the semen thing. The second thing is all the nerves which go around the prostate have a role in your erections, and all the muscles around the prostate and the nerves have a role in the urinary control. So when we take out the prostate, we also always tell to the patient that after the prostate surgery, you will not have any semen at the time of any sexual event. Secondly, your sexual things may get compromised. Thirdly, thing, you may have a urine leak. Because of all these three things, and mainly two things, and mainly urine leak, the open prostate and the laparoscopic prostate has got a very bad name. But in the earlier discussion, I told that whenever open surgery is done, the patient have something which become a burden to him. So that is mainly the urine leak. Because if you are not able to see what you are taking out, you are not able to preserve those nerves and the muscles. So in an open surgeries, you damage more rather than taking out. Now, when we do a robotic surgery, we are giving a 3D vision. Everything is looking very precise. I can see with this is the nerve which I have to save. I save that nerve. This is the muscle I need to save. I save that muscle.
Mhm.
So the urine incontinence is practically now become a very, very less significant factor.
Mhm.
So I just assess my data of hundreds of prostatectomy, and most of my patients, in fact, I can, God is kind to me, 100% of my patients after 3 to 6 months of the surgeries are without any diaper.
Okay. And Dr. Tyagi, are there ways to overcome the side effects like the loss of erection, uh, or also, like you said, that the ability to produce semen is not there after this particular surgery. So, in case somebody who is younger and is facing this particular problem, do you advise things like sperm banking before you actually have them undergo a surgery?
Yes. But to be honest, majority of my patients are more than 55. But yes, this thought came to my mind when I have a patient of 52. I asked him, "Do you have completed your family?" He said yes. And because he's 52, and now because anybody can have a child at any age. So I asked him, and most of the patients said, "Okay, at this age, I don't want a kid." So practically, sperm banking, I never advised to any patient. But yes, with the age of the cancer prostate is decreasing, this is a good option. This we also prescribe to the patients who have testicular cancers or the cancers treatment which can affect their sperm production. So sperm banking as a treatment, as a prophylactic use is very much recommended. Not so much in cancer prostate because majority of patients have passed that age group of having a child. But we do counsel them that you do not have a semen. So if you have anything, most of the patients say, okay, Doctor, I have completed my family.
Mm.
I don't need any semen.
Got it. So, but how do you help your patients overcome the side effect of loss of erection?
So then the loss of erection and also the urinary incontinence. So loss of the erections, again, we assess the patient pre-operatively that how sexually active you were before the surgery or you are right now before the surgery. So there are three group of patients. Say somebody who is 65, 70, or might be 60 also. He said, I'm not active. Uh, the erection does not matter to me. They specifically said, it is all about the cancer. I'm not affected by it. I'm not active for last 2 years or 3 years or 4 years. So it doesn't matter to me. So we're not very much counsel them. Now, the second group of patients are who says, okay, once in a while we are become sexually active. So it is always better if you can preserve it. And the third group of patients who says, we are sexually active. So as a surgeon, then this particular assessment can tell me what the patient expect after the treatment. Then, as per the patient disease, we counsel them. Because ultimately aim of radical prostate is to take out the cancer, not to preserve the erection. You cannot preserve the erection at the cost of the cancer. So suppose if somebody have a more advanced cancer, he is 55, 56, and he want to preserve his erections. I say, okay, man, I want to take the cancer out. I have a treatment for your erectile dysfunction later on. But this time, the main objective is to take your cancer out. But if in any time I feel that this nerves can be saved and I can prevent the erection, we do all the things which are required to prevent the erections without compromising the cancer result. And regarding the urine leak, which is most actually um, thought about complication of radical prostatectomy. So that is somehow one of the very small preparation which we do in the time which we are waiting after the biopsy. So suppose biopsy done, it is a localized cancer prostate, and we feel that okay, now you need a radical prostate. So we advise them to build their muscle to prevent the urine leak. So you have must learn about Kegel exercises. These are the exercises which are basically to strengthen your pelvic floor muscles. So we train the patient, okay, you are waiting for the 3 to 4 weeks. You start doing these exercises so that the muscle strength will increase. So what happened at the time of surgery when I take the prostate and the whole burden of stopping the urinary leakage is on the muscles are strong enough to take that brunt. And yeah. And lastly, one of the factors which also determine the outcome of the erectile dysfunctions and the urinary leak is the age of the patient.
Mm-hmm.
So not all the patients are same. It is the age of the patient also matters. So somebody who is in a 50s has a better result as far as the erections is concerned as compared to somebody who is in 70s or 80s.
And Dr. Tyagi, my last question to you for this is that what is the life expectancy after robotic prostate surgery, especially in the cases of cancer? How fast does this cancer spread if not worked upon immediately?
So one thing, the cancer prostate is, I think all the cancers are bad, but it is good among the bad. So cancer prostate does not have such a lethal penetration as compared to all other cancer like lung cancers or liver cancers or gallbladder cancers. So uh, when we are talking about these cancers, the cancer prostate has a less effect on your life survival. But yes, it do has. And it all depends upon the stage of the cancer. So if we say the stage one, if we treat the stage one, the life expectancy is more than 95, 96%. Now the patient comes at a very early stage diseases where we say practically you are cured of the disease. There are very less chances that you will die now because of the cancer prostate. If it is stage one. Stage two, this percentage of survival decreases to say about 93, 94%.
Mm-hmm.
Stage three, it decreases to 85% because once the stage three becomes, there's a very significant difference of the survival. And if it's stage four, it is still 60, 70% if we treat it. But then you have to take a treatment which is lifelong. But once you do a surgery is an event. But
Right.
treating a stage three and stage four disease is a process, whole process.
Uh-huh. No, I completely agree with you because I think, I always say that, cancer treatment is a journey. It is not just one thing that you do and you get over with it. I mean, uh, what are the chances of recurrence of cancer in cases where, for example, if it is stage two or more and you do the surgery, but what are the chances? What have you observed in your observing your patients? In how many cases does the recurrence actually happen?
So recurrence in any cancer is possible. Stage one is very unlikely if you take on the whole thing. Yes, stage two, three, and four, the recurrence are higher, right? I would say that in my practice, stage three disease have a much more recurrences, right? After the radical prostatectomy, somehow we found the lymph nodes are positive, and it's about in the tune of 5%, right? But those recurrences can be taken care of.
Mhm.
Now it is if the disease become stage three, stage four, there is a role of multimodality treatment in
Mhm.
which we are offering surgery, also radiation, also chemo or hormonal therapies.
Got it.
So it's more like if your enemy is more dangerous, you have to use all your Air Force or Naval and Army. But if something can be taken care by just a missile attack, why to waste the army?
Absolutely. So I think what I understand is that it's more of an integrated approach of everything related to prostate cancer that needs to be done. So you do your surgery, but after that, your treatment actually continues, and so you may need to go in for chemotherapy, etc. Uh, Dr. Tyagi, thank you so much for spending time with us and making us understand how robotics has brought in uh, a kind of chance for a treatment which did not exist 20 years ago. But today we have a chance where we are doing surgeries through robotics, which are helping both the doctor because it's going to make it easier for them. When it is done in a, like you said, in a more comfortable environment, the doctor has more confidence on the outcome that they can create for the patient. And for the patient also, when the chances of a better outcome is better, there is less risk. And more than anything else is a quicker recovery, which makes them get back on their feet to do their daily course much earlier than what was possible when they were doing surgeries through laparoscopy or even before that through incision. So thank you so much for bringing this out for us and sharing this information with us. Thank you for your time, sir.
Thank you, Mr. Narora, to give me an opportunity and always say a message to all my patients. Cancer is not as dreadful as it is considered to be. Sometimes a localized cancer prostate is less dreadful to a patient who is having a diabetes for last 10 years. So he doesn't bother about his diabetes, much bother about the cancer. If treated good, cancer can be less lethal as compared to a diabetes.
Absolutely. Absolutely. In fact, on that note, I must tell you, Dr. Tyagi, that, I'm actually getting associated with a lot of cancer forums, trying to work on only one thing, that we need to normalize cancer and give a message that, listen, you still have a life despite cancer, and your life should not get affected. If you are a cancer survivor, don't live a life of a victim. Enable yourself to live a life like anyone else.
Great.
Thank you so much, Dr. Tyagi.
Thank you, Mr. Narora.